I think we're good to go. Thank you for being here tonight. What a great turnout. How many people are tired? My name is Rick Cluff, and I host the early edition on weekday mornings on CBC Radio. And as a guy who spent nearly 40 years in early morning radio, I'm intimately associated with sleep disorder. My alarm goes off every day at 3:15 in the morning. I don't get that much sympathy at home, so thank you. Sleep disorder therapy, though. I can honestly say it probably saved my life. And you'd be amazed at how many people in my business have some sort of sleep disorder because of the hours we work. I had a doctor ask me, one of the doctors here, so do you get your 8 hours? And I looked at him and said, in my wildest dreams. So we're going to talk about that tonight. But before we get on to the program, let me tell you about what's coming your way. In a few minutes, we're going to hear from our keynote speaker, Dr. John Fleetham, who most of you here well associated with know what he does. We'll also convene a panel of experts over here who come from 4 disciplines of medicine, all of which have a direct relationship to sleep disorders. And there will be a question and answer period afterwards where you'll be invited to ask your questions to any specific panelist over the panel in jail. We'll also hear from the president and the CEO of the VGH and UBC Hospital Foundation. And we've got fabulous prizes to draw for. You will all go home with gifts, including earplugs. I'm really glad I didn't give them up beforehand, but you will get them at the end. We'll tell you why in a minute. For those who tweet, we encourage you to tweet and use the hashtag #VanSleep. And by the way, the folks here from the VGH and UBC Hospital Foundation will be live tweeting this event tonight, and you can follow them at VGHFDN. That's to come. But first, we're going to start off with a short video about sleep apnea. Now, sleep apnea is a sleep-related breathing disorder. Affects 3% of Canadians 18 years of age or older. One of the many sleep-related conditions treated by physicians and related health professionals at UBC Hospital Sleep Clinic. And we're going to learn more about the sleep clinic and the sleep disorders clinic a little later on. But right now, roll the video.
Tonight, we begin a 3-part series on sleeplessness. It's a universal problem that nearly every single one of us will deal with at some point in our lives. There are a host of different causes, but the most common and the most deadly is sleep apnea. 1 million Canadians have been diagnosed with it. Millions more don't even know they have it. And that's endangering not only their own lives, but others too. Randy Neal reports.
Giuseppe Cuzzetto follows the same routine every single night before he goes to bed, preparing and putting on a machine that he says saves his life.
Sleep apnea is really not breathing. You know, it's as if your head is being pulled, under a pool of water.
Sleep apnea is a condition where people stop breathing during sleep, wake up, and fall back asleep. It can happen hundreds of times a night, and the vast majority of Canadians have no idea.
At the time, it didn't seem scary. At the time, I kind of led like a zombie-like existence. You don't really feel much of anything except you're kind of half awake, half asleep most of the time.
Giuseppe is far from alone. An estimated 1 in 4 Canadians are at risk of suffering from sleep apnea. Twice as many men as women suffer from it. It's as common as diabetes and high blood pressure, and just as dangerous.
It's a problem because it predisposes to a variety of symptoms. Okay, the commonest symptom is sleepiness, and also predisposes to a variety of cardiac problems, such as predisposes to heart attacks and strokes.
So death, possibly.
Yeah. So we would look at everything.
Dr. John Fleetham heads up the UBC Sleep Clinic in Vancouver.
But this is a person with classic sleep apnea.
Yeah.
He and ICBC compared the driving records of 1,600 people with sleep apnea and 1,600 without.
That's snoring. So this is snoring. So if you have sleep apnea, you're 3 or 4 times more likely to have a car crash, and that's a major concern.
According to the Lung Association, a study done in Saskatchewan found sleep apnea caused $30 million worth of related car accident damage in that province every year. In 1995, the University of Calgary found an estimated 78% of long-haul drivers suffer from sleep apnea. It's a growing problem caused by obesity.
Every man knows that as you put on weight around your tummy, okay, you also put on weight around your neck. And as it gets bigger out here, it gets smaller inside. So neck circumference, you know, if you need a size 17 or 18 shirt, then there's a very high likelihood you're snoring, and a very high likelihood you might have sleep apnea.
There's no cure for sleep apnea. Losing weight can ease the problem, but the best solution is CPAP, a machine that forces air through a patient's passageways. That's what Giuseppe wears every night. But while most provinces and countries cover it, the $3,000 machine isn't covered by BC's health system.
In BC, many patients go untreated because the treatment is not paid for by the healthcare system.
Giuseppe can afford it. He says it's a small price to pay to be alive.
Had you not been diagnosed, where would you be right now, do you think?
I don't know if I'd be alive, to be 100% honest.
You know, I've been in medicine now for close to 40 years, okay? And of all the things I've done in medicine, it's the most rewarding thing. Many patients will come back and say, I feel 1,000% better, okay? Many people will come back and say, it's a miracle.
It's much better, and I have the ability to, you know, go for walks or engage in life and be present.
Sound familiar? Our keynote speaker tonight is Dr. John Fleetham, who you saw in that video. Dr. Fleetham is co-director of the Sleep Disorders Program at UBC Hospital. He's practiced respiratory and sleep disorder medicine since 1981, has been a professor of medicine at UBC for more than 12 years. He founded and co-directs the Vancouver Acute Sleep Disorder Program, has published more than 100 articles and a number of book chapters on differing aspects of sleep disorder. Ladies and gentlemen, Dr. John Fleetham.
Thank you, Rick. Thank you all for coming tonight on what is, I think, a very important topic. I'm going to spend about 15 minutes talking about sleep. Yeah. So why should you care about sleep and sleep disorders? Well, poor sleep equals poor health. If you want the secrets to a long and healthy life, it's exercise, it's diet, and it's good sleep. And we spend a lot of time talking about exercise, a lot of time about diet, but actually only twice a year do we talk about sleep, and it's usually when the clocks go back. Some of you have a sleep disorder, as you know, they're very common, and I would estimate 50% of this audience has had a sleep disorder or will develop a sleep disorder sometime in the future. And poor sleep and sleep disorders result in impaired quality of life and reduced life expectancy. We don't need the slides. This tells you a little bit about sleep. You have both a sleep urge and a sleep need. Well, there's a typical circadian rhythm in terms of your body. The sleep urge is greatest during the night, with a small increase during the midday. That's why we all feel a little bit sleepy, sort of after lunch. And the sleep need progresses throughout the working days and is replenished in terms of sleep. Excellent. Causes of poor sleep. Well, it started when the light bulb came out. And then we had television. And then we had the internet. And in the basement of my building, the Starbucks, and we had caffeine. And so those are the four causes in terms of poor sleep. What are the consequences of poor sleep? Well, I'm very familiar, and so is Rick, because that's how I feel when I've been on call during the night. The next day I have trouble focusing, I'm not as smart as I usually am, I'm a little bit more irritable. Interesting, what our mother sort of told us is you're more prone to infections, and actually if you don't sleep well, you're more prone to catch a cold, to catch a pneumonia. And you want a take-home clip to take tonight to actually make sure you sleep well before you have the flu vaccination, because it will improve the efficacy in terms of you don't sleep, you tend to put on weight, you tend to have diabetes, you tend to be more prone in terms of occupational motor vehicle accidents, and you have a reduced life expectancy. This just shows that there's a sweet point in terms of how long you should sleep. If you sleep less than 7 hours, there's an increased risk of mortality, and if you sleep more than 7 hours, there's an increased risk in terms of mortality. 10 tips, okay, as part of your package, I submitted 20. Somebody actually culled it down to 10, and I'll tell you about the 10 tips for good sleep at the end of this. Sleep disorders, okay, so you don't need to see a doctor in terms of sleep, you need a doctor in terms of sleep disorders, and it's estimated 45 million North Americans suffer from disorders of sleep or wakefulness. 95% of these remain unidentified and undiagnosed, and the average direct cost is 16 billion, and the additional indirect cost is 100 billion. So this is a big issue, okay? People are falling asleep, they're not productive, they're having accidents, they're having hospitalizations. What are the symptoms of falling or sleep disorder? We're all aware of this. Not being able to fall asleep, but also, this is another symptom. Daytime sleepiness. There's a variety of interesting things about this. I mean, sleepiness is a symptom in terms of, I'm not a big fan of Donald Trump, but I hope he actually sleeps a little bit longer. But sleep, you know, you think of other diseases, and you would never laugh at someone who had a stroke, you would never laugh at someone who had polio, but here we laugh at somebody who's sleeping. And sleeping, sometimes I go to some faculty meetings, and sometimes falling asleep would be a bit of a blessing, but it can be a problem. I've dealt with lawyers or judges who fall asleep during trials. Heaven forbid, I've dealt with anaesthetists who fall asleep during operations, and it can be a significant problem. And something that happens, you'd be amazed how often it happens, okay? And that's actually falling asleep at the wheel. A number of people sit in my office on a daily basis and said, I fell asleep at a red light. I saw this as a bumper sticker recently, and it's sort of, you laugh at it, and then it's one of those things where possibly it's how it's done. So everybody thinks sleep disorder, I know all about that, it's insomnia and it's sleep apnea, but here's a short list in terms of you're not supposed to read it, it's just supposed to impress you for lots of sleep disorders. I'm going to tell you about 4, and then it's going to come up in the panel discussion. So there's insomnia, it's very common, it's difficulty falling asleep, there's difficulty staying asleep, and then there's waking up early in the morning. The sleep apnea, we talked a little bit about it. It's very common and as important as high blood pressure. Untreated, results in daytime symptoms, especially sleepiness, and predisposes to heart attacks and strokes. And there are a variety of different treatments, okay? When I started the clinic in '81, the only thing we could do is actually tracheostomy. You know, we saw CPAP, and everybody comes to me now saying, well, I have to wear one of those horrible machines every night. There are a variety of different treatments in terms of sleep apnea. Narcolepsy. Narcolepsy is what many people sort of think is sleepiness, but actually it's a very specific condition. It's some uncontrolled sleepiness. People will fall asleep very, very easily. And then they have something called cataplexy, which is intermittent sudden loss of muscle tone triggered by intense emotions, okay? So the typical story is a poker player who gets a great hand and then drops it, or I'm a golfer who has a great drive and then falls to the ground. That's cataplexy. It's quite common. It occurs in 1 in 2,000 people, and it usually presents, unlike sleep apnea, relatively young and can run independent. Parasomnia is another whole group of conditions that we deal with, and if you want to summarize that, it's strange things that happen to people while they're asleep. It's sleep talking, it's sleep walking, it's night terrors, it's sleep eating. And a very specific one, and it's going to come up in question period, is REM sleep behavior disorder, which is violent activity during the night. It occurs in men over the age of 50 and And up to 75% of those people then go on to develop neurological disease, especially Parkinson's. So it's something which we're going to explore some of these sleep disorders a little bit later. You may think, well, sleepwalking doesn't sound very serious, but you may remember Chris Hyman. He died tragically a couple of months ago. And I have no inside information, but his mother is quoted that he died because he was sleepwalking and fell off the terrace. How do you get help in BC? Well, sleep centres is part of medical coverage, it's part of your MSP coverage, and there are 10 sleep disorder centres through BC. BC is divided into regions. There are 2 in every region. You're here in Vancouver, and the 2 centres actually under common management. One at UBC Hospital, one at Richmond, and then there's one up the road at Children's Hospital, which deals specifically in terms of children. The UBC Hospital, which we're associated with, was established 1981, some time ago. It's multidisciplinary. I'm a respirologist. In the room are psychiatrists, neurologists. We have dentists involved in it. It's a combined clinic and 6-bedded sleep laboratory with specially trained technologists. Next slide. It's the provincial centre for complex sleep disorders. We see over 5,000 patients from all over BC and the Yukon. We're an academic, as you heard, so we do the majority of teaching for the undergraduate, postgraduate, and continuing medical education. And we have major research programs. We have to do work in terms of research, and we're involved in many different sleep disorders. A little known fact is that we held the world record for snoring. I've published everything, about 150 papers. None have impressed my children. But when we made the Guinness Book of Records in 1987, my whole family was very impressed. And Mark Labarge, who then actually, we recorded at 90 decibels, whereas actually the traffic bylaw is 80 decibels. And so we no longer hold it anymore, but it's a little known fact. I thought you would be interested. And next. So the future, we're here, part of, because we're planning the future, as there's increasing recognition, there's increasing demand, and we're in the process of expanding to a 9-bedded sleep laboratory and clinic. Everybody got Fitbits for Christmas, or something I did, and we're pioneering using wearable devices, and so people don't have to sleep in hospital, they can sleep at home, and we're using telehealth in terms of helping with that. Sleep disorder is a subspecialty in the States, and everybody in the audience here has at least 8 years of postgraduate education. And so we're starting next July the first national training program in terms of that. We're going to have a training program in terms of sleep technologists. And then we just received an award from the national government. They're trying to link all the sleep centres across Canada. So we've got a $4 million grant in terms of doing that, just in terms of research. But the moment you've been waiting for is the 10 tips for a good sleep tonight. Okay? First, next slide. Ban blue light in the bedroom. Next. What does that mean? Turn off the TV, the computers, and every other blue light producer, which occurs at least 1 hour before sleep. Okay? Everybody has a cell phone. We all take them to bed with us. We all, during the night, they go buzz with each text, with each phone call. Leave them downstairs. Okay? If you want to know something to invest in, it's buy an alarm clocks. Okay? Buy all your relatives alarm clocks so they leave their cell phones out of the bedroom. Next. Avoid naps. Okay? If you feel like a nap, go for a walk. Next slide. So when the afternoon slumps, usually sort of after lunch, go for a short walk, call a friend, drink a glass of ice water. Cut the caffeine. I'm pleased to say I went caffeine-free about 10 years ago. I'm British, as you can tell. How could I go without a cup of tea? But I managed it. It's not only cups of tea, read the labels. A variety of things actually contain caffeine. Next. Stop sipping after 8 p.m. A lot of people have to get up during the night and everything like that. Stop sipping after 8 o'clock. A lot of people like a glass of wine in the evening. Try and avoid that, okay? Because alcohol will make you fall asleep, but then it will destroy your sleep. Lower the lights. How we sleep is very much dependent on the light. How to get over jet lag is to expose yourself in terms of sunlight. One way in terms of getting ready is actually use a 15-watt bulb in the evening for the last hour before you go to bed. Okay? That will help you in terms of initiating sleep. Neutralize the noise. Okay? If you live downtown, it's full of sirens and everything like that. A variety of things which you can do in terms of doing that. You can buy earplugs or like noise generators. You can use a fan or an air conditioner. Okay, I'm a respirologist. Skip the smoke. None of you should be smoking anyhow, but you'll sleep a little bit better if you don't sleep in the 4 hours before you go to bed. Keep the pets in the place. You'll be amazed how many of you seem to. So I now have 4 people who've been diagnosed with sleep apnea by their dog, who's actually woken them up. So that may be a reason to actually keep your pet on the bed, but actually get rid of the bed. Okay, in many ways in terms of. And don't use sleeping pills. Okay, use sleeping pills 1 or 2 nights, but they're bad. You actually live shorter. If you take a sleeping pill, it makes older people confused. It increases injuries, and so sleeping pills should be used very cautiously. And then this Saturday, enjoy Halloween, and then go to bed. And remember that the clocks go back, and remember some of these tips which we've given you in terms of having a good night's sleep.